duties today relative to that. Many employers are hiring only part-time new employees, usually 28 hours or less. Some employers are reducing current full-time employees to part-time. And many small employers, which is the core of job creation, will not go over 49 employees because of the challenges presented in the various rules and regulations. Is part-time employment becoming the new normal? Anybody like to go first? Tim, I'm going to pick on you.
Well, I hope not. However, early indications, as they say, early returns are coming in. And regardless of whether the Affordable Care Act will be continued as the law of the land, which it is, or whether it will be repealed, businesses have to assume that the law is in place. And so based upon the best information that they have, getting from Ernst & Young and other auditing firms, accounting firms, tax firms, that are trying to give them some reasonable understanding, which they always end their seminars by saying, this is the best information we have so far. We can't say that it might not change down the road. You have to take consideration. So that's why we're seeing them decide whether they go to 50 employees. And holding 150 town hall meetings in my district last term and on the same pace this term. Doing manufacturing place visits, small business visits, I'm finding businesses doing that very thing. They're either staying under 50, and that doesn't totally absolve them from the cost of the Affordable Care Act. Cutting back employees if they can to under 30 hours, generally somewhere between 25 and 28, because if they make a mistake for a seasonal employee, and that employee works over 40 hours, just the one, the entire business comes under the full-time requirement. And so there's a danger there. Now, in America, we've always encouraged success. We've encouraged you to grow your business so you can employ more people. You can give more people the opportunity for the middle class, at the very least. We're destroying that opportunity. And I think that's evident when on July 2nd, the president came out himself and in a blog said we're going to delay the employer mandate by a year. What he's saying it's not ready for prime time yet. This is going to hurt our economy. I can't afford this coming up to a Senate election. That's crucial. Even more descriptive of the challenge was when Jimmy Hoffa and other union leaders sent letters to Congressman Klein and myself before a hearing I held in the subcommittee I chair, looking at the employer mandate. Jimmy Hoffa and others said, you must repeal the Affordable Care Act mandate. Now they did that because they had come to understand that when the president said, if you like your insurance, you can keep it, it is not true. And their letter said, we will not be able to keep the insurance that we've hard earned and won for our membership if the Affordable Care Act goes into place. Now that's not me saying it. That's Jimmy Hoffa. That's the Food Workers America Union. That's the IBEWE. They were the ones writing the letter. So we've talked about becoming a part-time workplace economy. That's their concern, along with many other things, including the loss of liberty in choosing our own selves with our own medical provider, the best care that we can have and desire for our own selves. There are other approaches that we ought to be able to take and we can take, and I'd be glad to talk about that for a time.
Rachel, you want to jump in?
I don't really know that much about the Affordable Care Act. I'm a state legislator. I will say that I do believe that some of those jobs that you're talking about, those people didn't have health care before, and they were working part-time. We have had a part-time economy for quite a while, witnessed the recession. That I know many people that have been unemployed or underemployed. I personally went without health insurance for a number of years, and I will tell you that anybody that has health insurance is paying for people that don't have health insurance out of your insurance right now. So there's definitely an argument to Congressman Walberg's point about the plan. I know I heard some folks speak from the state of Massachusetts where this program was implemented, and there are a lot of businesses that are in favor of it. I think like any complicated legislation, there is always room for improvement. However, I think it's important to provide health insurance for all our people because we pay for it one way or another. So let's try to get the best insurance for everybody so they don't have to end up in the emergency room where it's a waste of money and staff.
My account would be, I think today the state senate is looking at adopting this or not adopting it, and to me it seems like straightforward. Either we accept and get insurance for tens of thousands of citizens of the state, or we don't. Those tens of thousands would have insurance paid for without having to walk through the emergency room and slip the bill to those of us that have insurance and slide the floor to that back.
I have a question here just about Massachusetts. They've been at this a few years. Anybody have an insight into how well that's worked in the state of Massachusetts?
I went to a seminar University of Michigan had with a business. Well, it was the Small Business Association of Michigan actually coordinated that with U of M. And they are very much in favor of moving forward with the health exchange and also that Massachusetts program. The people from Massachusetts came and spoke and said it was working well. One of the issues is the cost containment. And I just, to what Kent was saying about the Medicaid expansion, that's what's up right now in Nancy in the Senate, which is why Senator Warner's not here. They're discussing the Medicaid expansion piece, not the actual health exchange. The expansion would cover, I think it's 100